Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Joo-Young Lee. He's a child and adolescent psychiatrist. Today's Kevin MD article, which he co-wrote, is titled Why South Korean Resident Physicians Are Quitting. Joo-Young, welcome to the show.
Yeah, thank you for having me, Dr. Poe.
All right, so Joo-Young has been on in the past. Go to kevinmd.com/podcast to search for his name and hear his story. But today, let's jump right into the Kevin MD article that you co-wrote with Jin-Wook Park. It's titled Why South Korean Resident Physicians Are Quitting. For those who didn't get a chance to read it, tell us what it's about.
So this is about, a series of events that unfolded earlier this year. So South Korean government announced an immediate 66% increase in medical school admission quota effective from the 2025 academic year. So this sudden change caught the attention of physicians, educators, and medical students, residents, all alike. However, the decision lacked transparency and scientific justification. So as a practicing physician, I felt very frustrated that such a critical change could be enforced without meaningful dialogue with providers and medical schools. So my colleague Jin-Wook and I decided to raise awareness of this issue within the US medical community. We hope it could spark some discussion about resident education quality and physician involvement in healthcare reform. So I can break down some of the situation in bullets. So first, the issue was about lack of evidence and transparency. The government implemented the significant increase without providing scientific evidence to support its urgency. So minutes from government officials' meetings about this discussion on this matter were not publicly shared, leaving stakeholders in the dark. And there is already a brewing core problems in Korean healthcare system. The first is low reimbursement rates. So hospitals faced financial losses of 10 to 15% for each insurance covered procedure due to inadequate reimbursement. And there is ongoing legal challenges. Physicians grapple with criminal prosecutions, not civil, to malpractice, as well as unavoidable adverse outcomes of their procedures. But in response to this, the government, considered just increasing the total number of physicians, believing that someone would trickle down into the underserved area. So in response, the residents, physicians resigned in waves, and medical students refused to advance to their first year residency. And many students even requested gap years, leading to empty classroom right now. And government is overlooking some critical factors. First is population decline in South Korea. It is facing the lowest fertility rate in the world, impacting the future healthcare needs and the physician surge. So even without the quota adjustment, South Korea already boasts the highest rate of increase in number of physicians among the OECD nations right now. And the government is not mentioning the cost implications of this change, because increase of number of physicians will inevitably increase medical expenditure, and which will require more taxpayer money in the future.
So you mentioned that the government didn't negotiate at all with the physicians. Did this come as a surprise to the physicians in South Korea?
Yeah, because there was some mentioning about potential increase in medical student quota. That was first time I heard was end of last year or so. But this number 2000 was just struck me so hard. And we were asking for evidence. Why 2000? Why not 1500 or 1000? But the government refused to answer, just saying that we're just lacking numbers. Projection of this trend will devastate the healthcare industry if we not act right now. So that just surprised me like so much.
All right. So what's the situation today? And I believe that this strike started earlier this year. And
Yeah.
what's the situation on the ground now?
So it is surprising that the gridlock situation between the government and medical society continues despite the passage of time. I thought by the time I would record this podcast, the issue will be resolved and that I'll be debriefing the whole situation. But I thought the Korean midterm election is over towards the end of April, and I thought the resolution will be reached, but negotiation is still far from occurring. It is significant that still over 90% of residents have not returned to their teaching hospitals, and the hospitals are not able to process resignations due to government's execution orders. Therefore, the resigned residents cannot work in other hospitals, even, and they're getting this financial strains. And the situation is putting the devastating strain on the whole healthcare system right now. And the media coverage is quite skewed right now. And when news outlets focus on justifying government reforms without adequately representing physicians' perspective, it creates an uneven playing field, I think. And what surprised me most is that it's trickling down. It's affecting the physicians who are seeking to come to the US. So there are J1 visa requiring physicians who just matched into the US training program for year 2024, year 2024. J1 visa was a track I also participated when coming to the US in 2018. But the government is delaying the issuance of this document called Statement of Need that needs to be processed in order to get J1 visa from the United States. And these are people who applied for, residency back in
Mhm.
September 2023, and it's not involved in any of this mass walkouts or anything. But they are getting this impact by the government, and they're not letting them easily pursue their training in the upcoming summer. So I am very concerned that this unprecedented situation is occurring, and the government is outright saying that they're going to make their life harder to emigrate to other nations for the physicians. But it is encouraging that the court is now actively looking into the legal cases filed by the residents and attendings. They requested the courts to help to halt government's unidirectional reform. And a few days ago, the court demanded scientific evidence justifying the need to increase medical student quota by 2,000 so urgently. And this shows the court commitment to evidence-based decision-making. And the verdict is expected around May 15th, and I'm very looking forward to hearing the result.
So give us an example on the ground. So the South Korean government arbitrarily increased medical school quotas to, I think the number you said was 2,000 more medical students per year.
Right.
You wrote in your article, what are some specific ways that increased quota is going to affect medical residents currently?
Like I wrote in the article, I already faced the hardship of sustaining a good training quality as resident.
Hmm.
Back in the day, I trained between 2011 and 2015 as a psychiatry residency in one of the, top teaching hospitals that's, considered top teaching hospitals in Korea. But even after training, I didn't feel confident with my skill set as a psychiatric resident. That's why I felt, oh, okay, I'll do residency one more time if I relocate to the US and I'll learn more. So I feel okay about having a second training. But even, but with this increase, dramatic increase of 2,000, which is 66%,
Hmm.
this will just fully populate the classrooms. And they were talking about we're even lacking cadavers for like anatomy lessons starting from first year med school. And the training hospitals don't have enough beds even to host all the increased number of residents. And the government did not do any research on this kind of issue, that the overpopulated teaching hospital could also become a problem to sustain a good training quality. And if the resigned residents from this year goes back and have to redo the year again, they'll collide with the newly coming medical student, and that'll just snowball into a total disaster. That year of medical school or residence will just continue to become an issue, and their training quality, I feel, would be totally devastated.
So those residents who resigned, what are some of their demands to fix the problem? Is it simply just asking the government to go back on their quota, or are they asking for anything else?
So a couple months ago, they promulgated, I think, six requirements they wanted in order to return back to their teaching hospitals. The biggest thing was to go back to the original spot of discussion and create this committee between government and healthcare professionals to start discussing about the real science backed number in terms of physician needs.
Mhm.
And the other thing was they really wanted for the chair of the Department of Health and Welfare to step down, blaming him for demonizing the physicians during this process. He used the media to portray the physician as, just they're doing this just for money.
Mhm.
They don't want the healthcare market to be saturated with more doctors. So I think they're really hurt about the whole, the whole movement that the chair of this ministry kind of created. So I think those two are the big requirements, and there are additionals, some of the requirement related to their teaching situation, teaching environment, and the quality, and like 36 hours of continued shift that's legalized under the current system. They wanted that to be reformed as well.
So, as the situation stands now, what's it like for patients? The fact that all these resident doctors resigned, are they getting the appropriate physician care?
So it is residents who stopped working that constitute less than 10% of physicians nationwide. And the physicians in private practice sector are doing their work. So are the professors in the major teaching hospitals. I heard there are some movement around professor resigning, but the number stands around 6.6% as of now. So it's not major. So they are doing their work, but they're overstretched. They're getting burnt out, but there are no major impact on patients right now. They are redirected to secondary hospital, and the tertiary hospital is very limited in taking care of the patients that they only can treat.
Mhm.
So they are kind of navigating through this newly balanced ecosystem of healthcare right now. But I feel like the patients are overall having this subjective uncertainty around their care, that they're quite uncertain whether the remaining professors and attending physicians might resign in the context of this whole movement. I feel like the total sense of urgency and uncertainty are the biggest impact right now versus the objective falling of the healthcare delivery.
So, are these resignations, are they making a difference? Is the government coming back to the negotiating table or reconsidering some of their positions?
Surprisingly, no. I am not seeing any significant change in their stance. I think the medical professional sector is awaiting for that court verdict as of now in May 15th, because they firmly believe there has been many violations in their constitutional rights during this process. So I believe they are waiting for this as kind of a watershed moment. But I really believe there comes some kind of a compromise between the two sectors, but I feel like they are just emotionally quite aggressive towards each other right now. And it's really hard to imagine them sitting down and talking reasonably toward each other. I feel like this court verdict will say a significant story into this table.
All right. So you are certainly familiar with the politics in South Korea, and of course, you trained in South Korea. Just from what you know about those dynamics, what's your prediction in terms of what you think is going to happen next?
So it's really hard to predict because when I was in Korea up until 2018, the the overall ambience I've been feeling from that government was more civil, and I didn't feel this much of a top down kind of a trickling down of command from the government. I felt like, there are checks and balances between, Congress and the government and the court system, but now it's everything's kind of different, and the messages I'm hearing from the media makes it really hard for me to kind of, extrapolate from my experience of my life in Korea. I feel like it's a drastically change. So I think many people are on the same page. It's
Mhm.
just so unprecedented, and it's so hard to anticipate. Like I said, as of, the time I'd be recording this podcast, I believed that everything would be over and things were back to normal, but that didn't happen. It's just beyond my imagination at this point.
We're talking to Joo-Young Lee. He's a child and adolescent psychiatrist. Today's Kevin MD article that he co-wrote is titled "Why South Korean Resident Physicians Are Quitting." Joo-Young, will end with some of your take-home messages that you want to leave with the Kevin MD audience.
Yeah. So I believe residents play in a vital role in teaching hospitals, and their contribution should be valued and respected. It is essential to strike a balance between cost management and ensuring residents receive fair compensation and support and education. And I really believe resident needs a safe and supportive environment to learn and grow. A respectful atmosphere fosters confidence and encourages innovation. And residents are the future leaders of medicine, I believe. And by providing a positive and protected learning environment, we empower residents to envision a brighter future in healthcare. Yeah.
Joo-Young, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Yeah. Thank you, Dr. Fung.